Do you know what these are? Nope, they're gold dust. So, why are these things like gold dust? What happened to me 2 days ago? I collected my medication. I usually have 4 boxes of these. They test my blood glucose. There's 50 of the little sticks inside each one of these, and 4 boxes will last me about 2 weeks. I test between 12 and 15 times a day. Now, I test that many times to identify spikes in my blood glucose and to enable me to deal with those spikes via change in diet or to take a quick injection of insulin. On Tuesday, I collected my medication, and instead of having 4 boxes of these little sticks, I was handed 2. I didn't question the pharmacist. I assumed it was an issue with my GP. So I gave them a call. They said, "Why are you testing so many times?" I explained. The lady on the telephone said, "Okay, I'll speak to your doctor and I'll call you back, and she will let you know why we have halved your amount of glucose testing sticks." So Wednesday, following day, same lady calls back. "I've spoken to your GP. She says you should be testing 4 times per day, and that testing the amount that you are at the moment is excessive." And she gave me a speech. She wouldn't let me speak. At the end of that speech, I said to her, "Look, can you ask the GP to call me and I'll have a chat with her?" Which she did. Within 1 to 2 hours, the GP called me back and we had a long, detailed chat about why I need to test the amount of times that I do. This used up between 20 and 30 minutes of my GP's time, 20 and 30 minutes of my time. In the end, we concluded that we would go back to the amount of blood glucose testing sticks I was on before, and after my A1C I have my A1C next week, so I'll get a follow-up about 10 days after that. So in about 2 weeks or so after my A1C, we'll decide if we need to stay on this amount of testing sticks or go lower. I'm suspecting she's going to want me to go back lower again. Why is that? Because money, I believe. A GP won't tell you that. These little things are beginning to look quite expensive. And if you use 4 times these per fortnight, 8 per month, that's turning out to become quite a lot of money. I need to test this many times. If I don't test this many times, I don't know where my blood sugar's going. This is why we have continuous glucose monitors, CGMs, because a type 1 diabetic needs to know where his or her blood sugar is at all times in any given situation. That's because we don't want to spike into hyperglycemia, and some of us don't have the sensation of hypoglycemia, so we need to know what our blood sugars are doing. In the UK, we have something called the NICE guidelines, and NICE will indicate that a diabetic with a HbA1c of 7% or less should be testing 4 times a day. NICE will also indicate a diabetic who has a HbA1c higher than that should be testing upwards of 10 times a day, which is more like it, which is more like the norm. I mentioned these guidelines to my GP. She claimed to be looking at the guidelines whilst she was talking to me. She also claimed to have asked one of her colleagues to call me on 2 occasions to indicate that they would be changing my dosage of testing sticks. Whether that happened or not, I don't know. I didn't see any missed calls on my phone. Neither did I have any answer machine messages. I never miss a call. I've never missed a call off my doctors before. So I'm not going to accuse my GP of lying, but maybe something went amiss there. Okay, so I wanted to thank Martin, who sent me an email with some wonderful information in it about NICE and about a similar issue he had to deal with his GP. Martin's Twitter name is up here somewhere. Go and follow him on Twitter. Excellent guy. So that's going to be it for today. I've got my A1C in 6 days' time. You will be aware, if you watch some of my older videos, that my A1C last time was 8.5%, which is garbage. I'm hoping to be back towards, I'll be happy with 7% on this occasion. So let's see what happens. That will be the next vlog next week. Thanks for watching. If you want to watch some more, over there, sub to the channel, over there. I'll see you next time. Bye for now.